Namaste, all of you. So today we are going to talk about turmeric. I hope all of you are taking lots of it because of pandemic and because of the immunity. And you must have heard about so many things that turmeric can give you, right? But nobody has talked about that, how to take and what to take, and that too. Yeah, maybe from wellness channels and all those things. You must have heard many things. But from a doctor's point of view, particularly in Ayurveda, what we think. So let's talk about that. So first of all, I know that many of my students, even in other countries also, golden latte is becoming very popular, right? In India, the tradition was to take golden latte or turmeric milk whenever we get some internal injury, some accident, some kind of trauma, or some sudden, sudden blow to the internal organs. So, what parents used to say that it will stop any kind of inflammation inside, and it will stop the consequences of the injury, particularly for the internal organs, right? So for all the Indians, you must have taken all this stuff and you must have heard in any time in your lifetime. So now it's getting very popular again because we have a habit of taking U-turn for everything. First, we will go this way, and then suddenly there will be a change in complete shift to the U-turn. So there is a lot of going back to the traditions, and everybody is talking about turmeric milk, golden latte, curcumin capsules, and it can save you from the Alzheimer's, from the cancer. So I just thought that let's talk about all these things and what in Ayurveda we think about it, what is the right way to consume, and where you should take a precaution. So let's start with the things where you all are taking it. So I think many of you are taking just to increase the immunity, right? And then many of us are taking for hangovers, right? Many of us are taking for diabetes, hyperlipidemia, IBS, so many things, so many, right? Antioxidation effects and all blah blah things. But let me tell you that it is a very strong anti-inflammatory agent and very good for people who have a history of osteoarthritis or some kind of inflammation in the joints for rheumatoid arthritis. If you have a history of Alzheimer's in your family, and any kind of inflammation in your bowel. So yeah, so in all these conditions you can take. Good for hyperlipidemia also. Very good if you are having insulin resistance, somewhere your blood sugars are not in control. So in all these conditions you can take. But now the but comes in that you have to take in the proper doses with the medical doctor's consultation if you are under any kind of allopathic medicines. So just inform your doctor and take the permission from an Ayurvedic doctor that you want to take these things, right? So it was about this. Now I will tell you the doses also. If you want to take turmeric for some particular reason, first of all, we can take for dietary. As in diet we take a very small amount, very less quantity, so which can be okay. But if you are taking or if you want to take for some particular condition, then yes, you have to be careful. First of all, about the doses, because proper doses are required. Then you have to be very careful about the bioavailability of turmeric, because turmeric is hard to absorb in the body. That's why in Ayurveda, when we prescribe somebody, so there is a proper protocol and there is a proper way how to take it. It just cannot be, just gulp and just swallow and that's it. So it's not the way. We do not take it like that. So what you have to do is you have to take proper doses. You have to take for particular time period. So in Ayurveda, we say you can take anything for 45 days, and after 45 days, give yourself a break or consult your medical practitioner about it, right? So what is the proper dose? Proper dose is 3 grams, okay? But if you are having any kind of bleeding disorder, any kind of bleeding tendency, you are having gallbladder stones, you are having acidity, and if you understand Ayurveda, many of my students must be watching. So if you know that your body type is Pitta, so yes, then you have to be careful about taking the turmeric, pregnant women, anybody who is on blood thinners, right? And what else? Any kind of bleeding or piles or hemorrhages or bleeding ulcerative colitis. So in all these conditions, wherever blood is involved, you should be careful. And you should always talk to your doctor and take permission and give them a complete information what you are doing, right? So 3 grams is the proper dose, 45 days is the time period, and now how to take it so that it can be absorbed in the body, because as I told you, that bioavailability or to a capacity to absorb in the body for curcumin is very low. So what we need to do is, generally we prescribe cow's ghee with it as a very, very essential item in Ayurveda. Because turmeric is an Ayurvedic product, and in Ayurveda we give it as a medicine. So when we are using Ayurvedic medicines, or even anybody, it can be just in the homes you are using or some doctors using, that there should be the proper protocol according to Ayurveda, because frankly, it's an Ayurvedic medicine and this is the Ayurvedic way of taking it. Now, with the research is also proved it, right? So you have to take it with black pepper, curcumin. That is the name of the active compound in the turmeric. So you can take black pepper with it. So 2 to 3 corn of black pepper, freshly grounded, you can take. And you have to fry it very quickly in hot ghee. Cow's ghee will be the best thing to do. So that, or with full cream milk, you can consume it. There's a proper way of taking it, right? So now, in what conditions you can take? You can take in any kind of inflammation, like leaky gut, or if you are feeling antioxidation, if you have a family history of Alzheimer's or any kind of brain fogging and all those things, you have a history of stroke, any kind of, it is very good hepatic and cardioprotective also, right? So any people who are having any, because according to Ayurveda, it is the anti-kapha. So any kind of lipids, or you have a history of inflammation also, which can make you a susceptible person to have heart attacks. So then also turmeric will be very, very good. And you have to be very careful about kidney stones. If you have kidney stones or a habit of forming kidney stones, then you have to be careful. For acidity, you have to be careful. You cannot take it. Then if you are pregnant, so in good conditions, where you can use it, in abdominal cramps, small girls during menstrual periods, if they have cramps, it's very, very good in those conditions. Any kind of inflammation history, if you have in that also, it is good. For cancer, for arthritis, for rheumatoid arthritis, and for Alzheimer's, for any kind of skin issues, right? In all these conditions, you can take. It's a very good anti-aging. And Very good for eye degeneration. So very good for your eyes if you're suffering from glaucoma or low eyesight or poor vision and all those conditions. So these are the things where you can use it. And I told you already where you should not use it. So use your mind, do the proper doses, and if you want to take it for longer times, always consult your doctor, right? That's all for today. Keep smiling.